I guess we'll get started. I'm Susan Giampetroni. I'm Director of Clinical Affairs for the College of Public Health, and welcome to the second installment of our IPE seminar series. We're going to ask that you stay muted and put your questions in the Q&A, and then we'll answer these at the end. Today, we are honored to have Dr. Charles Ruchalski, who will share his experiences taking students and faculty to Vietnam on interprofessional healthcare collaborations. Dr. Ruchalski is a Temple University School of Pharmacy clinical professor. In 2007, he was recognized for his excellence in teaching with the American Association of Colleges of Pharmacy Teacher of the Year Award, which is based on student evaluations. In 2014, Temple University honored Dr. Ruchalski with an Outstanding Faculty Service Award based on his community outreach leadership in North Philadelphia, working to reduce rates of HIV and hepatitis C virus transmission. Dr. Ruchalski was recognized by Temple as a faculty hero for his work collaborating with the College of Public Health to decrease vaccine hesitancy and administer over 8,000 COVID-19 vaccines to residents of the greater Philadelphia area. In 2022, Dr. Ruchalski received the Sprouse Lecture Award, which is given to an individual who has achieved recognition within pharmacy for significant contributions to the profession as a distinguished practitioner, scientist, or educator. Since 2012, Dr. Ruchalski has led students and fellow faculty members on a Vietnam Pharmacy Medical Mission program that treats underserved patients who have little to no access to pharmacy and medical services. To date, his teams have treated over 35,000 patients with acute and chronic medical issues and assisted with the fitting of over 5,000 prosthetic limbs to patients suffering post-war injuries, trauma, and complications from chronic disease states. He has generated more than $100,000 for the program, and in 2018, his team was recognized by the Prime Minister of Vietnam with the highest honor given to a non-governmental organization for its charity work efforts in Vietnam. Welcome, Dr. Ruchalski.
Thank you so much, Sue. I'm going to share my screen, and hopefully you will all be able to see the screen. Let me first start, Sue, by saying, introductions like that, I view as like Listerine. A little bit of it makes you feel pretty good. Too much of it could make you feel sick. So I really am very, very honored that you gave this very, very nice, lengthy, in-depth bio of myself. I never think of myself as a hero or a someone who deserves all of that. So once again, I really do appreciate that.
It's all good stuff.
It is certainly an honor to be invited by you, Sue, as well as some of the faculty at CPH to give this presentation today. And it's also a privilege that I've had to work with the CPH faculty so closely over the last few years, as you heard, through our kind of COVID vaccine program, the Rapid Vax. So I've really gotten to work very, very closely with the CPH group. Those who do know me probably have a behind the scenes bet going right now that says over under how many times I'm going to show my daughter in the slide presentation. If you want to get involved in that, you certainly can put that in the box as well. That'll come towards the end. So those who know me understand what I'm talking about. First couple of things is, one, I do encourage questions. We'll leave enough time at the end that questions can be answered, hopefully. And lastly, I am by no means an expert in interprofessional education or collaboration. I know I've been asked to do this only because I basically live my life in an interprofessional healthcare collaboration professionally. A lot of the work I've done has been with nurse, physicians, physical therapists, dental, every other type of healthcare section as possible. So hopefully this is informative to everyone. As you can see here, there's two schools on this first slide. The School of Pharmacy at Temple, which I've been a faculty here since 2000. And then this collaboration that I have worked closely with in Vietnam is through a university, Mercer University down in Atlanta, Georgia, where the physician and other healthcare student groups and other healthcare faculty come from. So I knew nothing about mission work when I was requested to join this team. So I kind of went in there open-minded and came home from that first mission in 2012. And I think of this quote now every time I think about doing mission work, that the best way to find myself is into losing myself into the service of others. And that is true after every mission I go to. I hopefully come back a different person and hopefully a better person every time I go to do mission work and literally dedicate my life to the service of others. So just a quick brief mission objectives and goals of what this Vietnam mission is. Much of this mission is to bring needed healthcare to really primitive and isolated patients in the remote areas of southern Vietnam. And the intended goal, of course, is to continue our ongoing relationship with the two universities in an interprofessional way, providing healthcare to those in need, allowing students to experience and participate in not just pharmacy, but other medical and healthcare related activities as well. So we got the objective and the goal. Some of you here may be saying, well, why Vietnam? There's so many other countries that are in need. We have a lot of need here. So why go 12,000 miles away and fly 24 hours to get there and provide care to them? First thing is the physician I work with, he's Vietnamese. He was born in Vietnam, has a history that dates back towards the end of the Vietnam War. So he wants to go back and give to his culture and his population. And the other thing is, if you look at some of the bullet points on the left, that there's about 91 million people living in Vietnam at the moment, and they only spend less than 7% of their nation's gross domestic product on healthcare, as opposed to the United States, who spends a lot more than that on their healthcare. And as a culture in Vietnam, it's really based on extreme daily physical labor. They're a very, very hardworking and proud population. But the physical labor that these individuals go through affords them a lot of orthopedic illnesses. And the physician, again, that I work with is an orthopedic specialist, in addition to lots of other specialists. Okay? And then, you know, post-war, which they call the American War, we call the Vietnam War, post-war, there's still 100,000 amputees that reside in the country of Vietnam, mostly due to landmine injuries. And 80% of those individuals cannot afford custom-made prosthetics. They use tree limbs and tire to kind of roughly fit a leg or to get around. And that, of course, limits their ability to function, leads to infection and other things. So again, the physician I work with is a biomedical engineer as well, and his specialty is prosthetic fitting. So he goes with custom-made, cheap prosthetics, free of charge to any patient, but cheap for them to make and manufacture. This is an example of the interprofessional team. This is just one team, and this is on the smaller side. Towards the end of the slide, you'll see a larger team, which is kind of more current. But this is a mixture of medical, pre-medical, medical students, dental students, nursing students, physical therapists, pharmacy students, and there's really only a few faculty. I'm the only sole pharmacist that goes. There's one physician who's really in charge of the whole program, and there's a couple biomedical engineer faculty who help with the prosthetic side of our mission work. Once we get to Vietnam, there is no difference between the team, meaning some faculty wouldn't realize if I was a pharmacy student, nursing student, medical student, because everybody wears the same scrubs. We do all the same work together. So it's a real true vision of the collaboration of all the healthcare students. Just a little background on our clinic and our daily workflow. And before you get into these names and arrows, I just want to highlight the fact that, again, no matter your background of student or practitioner, you are involved in every one of these areas. So for example, a nursing student is placed in areas like the pharmacy time, and pharmacy students are placed in a place where there's physical therapy activities going on, and even in the prosthetics lab. So regardless of your background, you will rotate through each one of these areas. And throughout this brief presentation of the clinic, I'll just give you some highlights of each of these areas. For example, our patient intake. Again, patients will get invitations to come We're in the poorest provinces of southern Vietnam throughout the course of our 4 to 5 weeks spent in Vietnam. The government of Vietnam sends invitations to who they know is the poorest patients in that region. And they basically get a date and time to come to a makeshift clinic. They line up 6 or 7 a.m. The team typically arrives around 6 or 7 a.m. to start the intake process. And at the intake process, of course, there's chief complaints. Why are they here? There's past medical history. Do they take any medicines? Many times they just show us a Ziploc bag with a bunch of tablets in it, and we really have a hard time even identifying those. But then, of course, other students have to do blood pressure intake, pulse, blood glucose intake. So at this intake station, patients are separated between a medical group or just a prosthetics team group, but everybody goes through an official patient intake. We do bring official student Vietnamese translators to help me and other non-Vietnamese speaking students and faculty to communicate. But this intake station is where the whole process begins. Once the students get the patients through the intake process, they line up by number, and they're seen by this one physician on the left side of your screen. Not the one holding the clipboard, that is a student presenting that patient, but the physician Baxi Ha, who is in the dark blue scrubs on the left, he's the one physician that oversees the entire mission. So within this medical clinic, again, the biggest issues in our patient population in Southern Vietnam is orthopedic issues. They have, again, hard labor and malnutrition. That combination doesn't really set up very, very well for their bone health and their orthopedic issues. So students will evaluate a patient. They will present to the physician and or one of the faculty colleagues, and students are clearly involved in every aspect of the medical clinic. They do injections of vitamin B12, other types of prescribing of the current medications that we bring over with us, which I'll show you in a slide or two. Some of the typical orthopedic cases, sometimes patients do come with either x-rays and or MRIs of their area of issue. This is just an example of one of the typical orthopedic cases we see. If you could see on the right-hand side, the MRI of this individual's spine, you have clear bulging discs in the L2, L3, L4 area, which is providing this patient with severe sciatica pain and other issues. And again, our physician team does an amazing job of trying to alleviate some of these more severe issues without doing surgery. So he has a pretty unique technique. If you have any questions about that technique, we could talk about that later. But he does a pretty good technique. And I'll just give you firsthand experience. One of the years as I was on this medical clinic, I did develop sciatica, and he did treat me, and he gave me treatment during the course of the mission. And by the time I came home, 3 or 4 weeks later, I was able to run a full marathon in San Francisco. So literally, I believe wholeheartedly in his treatment, and just as one patient's experience, what he does work. Once they get out of the medical clinic, they go into a physical therapy area. This is where not just physical therapy students work, but again, every other part of the interprofessional healthcare team. Why is there a physical therapy component? This physician and we all really believe that since we can only be there once or twice a year for a short period of time, a few weeks, these individuals can't get enough therapy where they're at to kind of get to see us again the following year. So we feel that teaching them basic physical therapy techniques could potentially hasten and delay the onset of the symptoms that we were treating the time we were there until we get back. So they get, some interprofessional training and education on basic physical therapy techniques. Once they come out of the physical therapy area, they're kind of ready for checkout unless they're a prosthetic patient. And as you can see here, sometimes we set up pharmacies in somewhat existing clinics. Sometimes we do, if you look on the bottom right-hand side, outside at night under flashlight. because we treat every patient from when they arrive to when they leave. We never leave one patient untreated. So I call that pharmacy by candlelight. As an example of the types of medicines we bring with us and how we bring them, the majority of the medicines we bring are over the counter, either supplements, vitamins, remember the malnutrition that I spoke about, OTC pain medicines, Tylenol, ibuprofen, other NSAIDs. And then we do bring a select number of prescription items, antibiotics, creams, things that the physician has requested we try to get. All of the medication is donated either through our own fundraising efforts, and we purchase at cost, or get donated by pharmacists in the area. And we travel with all this medication in our checked-in luggage. So we're basically thinking about 1,000 pounds of medications being transferred from the East Coast of the United States to Vietnam. And we do have permission from the government of Vietnam to bring this type of medication over there. Every year we get a signed letter from the government that allows us to do so. But this is not an easy transition. The medicines they have over in Vietnam, patients tell us they may not work as well as the current medicines we have over here in the United States. Briefly moving over to what I call the prosthetics clinic area. As I mentioned, there's still currently about 100,000 individuals over in Vietnam with amputations, and many of that comes from landmine injuries. Some of it comes from trauma from moped injuries. Others come from complications of longstanding diabetes, etc. The prosthetic limbs that patients use pre us getting there, again, come from maybe wood, tree stumps, and they use rubber from tires to kind of use as feet or things to cushion them. And that does lead to a lot of, again, more orthopedic injuries, some infections, some other issues. So the physician team and biomedical engineer teams that we work with, they've developed lightweight, individualized fitted prosthetics. So between the sockets as well as the fake feet, the things that they would use, they could fit them when they arrive in the morning. They may have one limb missing, maybe two. When they leave that day, maybe 6, 8, 10, 12 hours later, they're basically walking out on their own with a very nice, lightweight, kind of individualized fitted prosthetic. This is something, again, you do not have to be a biomedical engineer to participate in this part of the clinic. The gentleman in the top middle, he's basically a pharmacy student working with a biomedical engineer student to help fit this prosthetic. On the right-hand side is a different healthcare student who, again, is assisting this individual with the making of a new prosthetic limb. I'll briefly go through a couple special cases that I always hold close to my heart because I was closely involved in these special cases during clinic. This individual on the left-hand upper left had cervical fusion. So his cervical vertebrae were fused together, and he told us that he could not twist his head more than 10 or 15 degrees at any given time. He would only get about an hour or two sleep per night because of the severe pain that he was in. And in the middle, there is an x-ray of that fusion that you really can't see too clear here, but you can see on the left that his basically neck is fused to one side. Below him on the left-hand side, the physician is injecting at that point lidocaine to numb the pain that he is going to do some manipulation of this individual cervical area. And right next to that, as you can see, this individual, by kind of manipulation, is trying to loosen up that fusion in the cervical area. Over multiple treatments over this one clinic, this individual ended up on the upper right-hand side of this slide, and he was able to then have 50 or 60 degree motion with his cervical region, and he was able to sleep 4 to 5 hours a night. So again, this individual without our care would probably have been living in pain and suffering for the rest of his life. Another unique special case was this scoliosis patient. This is actually a Vietnamese medical student who heard about our clinic and heard about our physician's expertise and arrived at one of our clinics day one. And you can see her x-ray on the left-hand side with the scoliosis bending towards the right side of her spine. Again, over multiple visits to our clinic, we were usually in one spot about 7 days at a time. This physician, by pure manipulation of her spinal cord, her spine, ended up at the end on the right-hand side with a lot less pain and a lot more of a straight spine. And this person does visit us annually when we go back to the same area, and she has gotten a lot of pain relief and improvement with this technique. And the last special case I'll talk about, this was one of my first cases when I visited this individual clinic. This child was born without a left lower limb. And as you could see in the upper left-hand picture, that's kind of a makeshift prosthetic for that little boy. It's kind of hard plastic. He wasn't really getting around all that well. And he arrived in clinic around 7 a.m. on the day he was there. And around 7 p.m., you see here on the left-hand side at the bottom, he's walking out with a new lightweight limb. If you follow the arrow to the right side bottom, since he's still a growing child, our prosthetics have to adjust based on his height and his age. So he does visit us on an annual basis to get adjustments and or new kind of size-related prosthetics. But, you know, the interesting part about this patient that I always hold dear to my heart is he didn't complain. He didn't need anything for the 12 hours. He basically sat in that waiting room. He was patient. He made me realize the little they have over there and the appreciation they have of what they have. He didn't need the newest iPhone, iPad, this and that. All he needed was someone to kind of chat with, someone to keep him comfortable, keep him warm. I literally basically taught him how to thumb wrestle. If anybody knows thumb wrestling from when I was a child, and we could just sit and play and communicate without speaking Vietnamese. We can communicate just by playing games. And it just touched my heart that the patients over there appreciate what they have, and they don't really need the newest versions of things we have here. And then when I came home here, the first thing I heard my niece or nephew want was the newest iPhone. And I just kind of reflect back to this patient that he was happy, patient, and he now walked out with a very, very nice fitting, lightweight prosthetic limb. Of course, all of this does not come kind of cost-free, including the exhaustion that sets in with every one of our healthcare practitioner student team. So we have some nursing students, medical students, bioengineer students here. These are on bus travels from one clinic to another. So the days off that we call days off are usually an 5, 6, 7, 8 hour bus ride from one clinic province to another clinic province. And you could just see these students are exhausted. They're working 12-hour shifts, 110 degrees every day when we're there, and without really a complaint. Yes, they're exhausted, but the students that return tell me it's the best experience really they ever had. And then, of course, once we get done our clinic, there is also time to celebrate, right? So we do have a great time over there when the work is completed. We celebrate birthdays, we celebrate dinners, we celebrate anything we can, right? You need to lighten up. You need to appreciate each other as a team. We didn't know each other much before we got to Vietnam. By the time the mission is almost complete, we're now one big, large 40-person family. And of course, if you look down the right-hand side, nothing escapes Dr. Ruchalski. They'll get me with cake and cake in the face, just like we would get the students. So all great fun and games post-clinic. I would also not say going to Vietnam should all be work, work, work. So I do twist this in a little bit of a cultural awareness situation. So we'll get to that in a little bit. There's charity in addition to the medical work we do. So this is one example of some of the charity work we do in addition to medical. This is a church that basically is in the poorest region of southern Vietnam, and it's host to a grade school. And we've raised money for some charity work. And as you can see here, we've purchased for every one of these students the year's worth of books they need. And we also paid for a year's worth of tuition for that whole school. Just to give you an example, $2 United States pays for 1 month's tuition for one of these children. So every dollar that we raise, you can imagine how far it will go over there. So we basically paid for their whole family's tuition for a year, as well as distributing books to each one of these children. And then, of course, they are so appreciative of a team coming and showing how much they care and how much they're willing to interact with them. Just seeing the smiles on these individual faces, really, if it doesn't warm you, by the time you come home on that flight, it's hard to say you'll ever be warmed, because these individuals are so grateful for everything we're doing for them. As I said, I do like to have a little cultural awareness. So we do a little bit of traveling, either pre or post clinic time. So you can see it's a beautiful country, which was very often a war-torn country. But it's nice for the students of all healthcare backgrounds that have never been to Vietnam to explore some of the culture, amazing culture that's available in that country. They're all exposed to some of the traditional Eastern medicines. So this is a museum of traditional Vietnamese medicine that we bring the whole team to, so they can explore what the history of medicine is in that area. And I'd be remiss if I didn't talk about the amazing cultural food that the students do get a chance to experience, not without having some GI distress, of course. But there's some real great opportunities for them to learn about the culture, as well as give back to that culture from a hardworking medical standpoint. I look at these missions that we impact patients in a certain way over there. And one of the most rewarding things is that we can provide a warm and safe atmosphere for patients who really need healthcare services that would otherwise be unavailable to them. Medications that would otherwise not be accessible, we're able to provide for them. Even if it's just a short-term fix, we're able to help in the best way we can. Through proper translation, we're actually able to provide proper counseling, medication usage and storage, which they're totally not aware of when you interact with them. We do serve as a source of charitable contribution. And I believe every time we leave, we give them an indelible impression of our compassionate Western humanitarian efforts. There's a flip side. Every mission has an impact on our student group. Every interprofessional healthcare student comes home, again, a different person. It improves their skills, right? Their clinical competency, their problem-solving skills, but also their appreciation for an international patient population. It offers students hands-on experience, providing patient care, some other services and counseling. And then again, from an amazing interprofessional collaborative standpoint, it allows students the chance to participate in not just their area of expertise. So a non-pharmacy related medical activity, physical therapy, for example. I never thought I would ever help fit a prosthetic limb for a patient. That's coming from me, who's been in practice for 35 years. It also is an opportunity for students to network with each other from universities and students from Vietnam. So what do I think potentially the future of IPE could be? So here we are. This is my daughter. So the future of IPE could be something like this, maybe. From whenever she was young and born, on the left-hand side, she wanted some scrubs. She walked around with her doctor kit. Right in the middle, when we were doing rapid vax training. Yeah, why not? Let's train a little girl on how to give vaccines. And then on the right-hand side, she's growing and taking care of her little babies with her stethoscope. And who knows, maybe she becomes a pediatric nurse, doctor, or pharmacist one day. Is that the future of IPPE for her? Or maybe not. Maybe she gets the opportunity to do other things. So she could do anything she wants. I'm certainly not pushing her into the healthcare field, but she has experience in lots of different areas. And I hope all I want to do is be a hero to her. I say the word hero to me is it depends on who's reading into it. If I'm not a hero to no one, I would rather be a hero to my daughter. So there's acknowledgments to have to happen about everything I do in my life. This is my wife, my beautiful wife, and my beautiful daughter. Nothing in my life happens without them. So I have to acknowledge them officially through a photo. And then more of an official acknowledgement has to come by the administration here at the School of Pharmacy, former Dean Peter Dukas, who supported this program from 2012 up until 2019, and current Dean Jay Panium. Even though we have not been able to travel since the pandemic and we're looking forward to future missions going forward, he's certainly on board with continuing this type of IPE experience. And then our APPE, which is our Advanced Practical Experience, and our Introductory Practical Experience office does a lot of the legwork. When you coordinate collaborations with another university, there's a lot of paperwork, there's a lot of legwork that goes on. So I do have to give them my most heartfelt thank yous. Mercer University's administration and their physician, Baxi Ha Van Vo, who again is an MD, PhD, doctor of podiatric medicine. He's really got the heart of 100 men. He never ever complains. He sees every single patient that we have to touch base with. So again, I'm enamored by Dr. Vo in all his dedication to charity healthcare work. And then Van Bui and Tao Win are the administration on his side. And of course, every donor and every contributor that gives to our program, nothing happens without some financial backing. So any donor, any contributor, I always have to give a 100% acknowledgement to. That kind of concludes the official formal talk. Thank you for your time and listening. I think that this is a very unique interprofessional collaborative practice. Again, you cannot probably list a healthcare practitioner who hasn't been with us on this journey for the last 8 to 10 years. So I think it's ideal for students as well as the healthcare teams to kind of grow from this. Not every IPE experience is going to be like this in Vietnam, but this is kind of my most in-depth IPE experience that I've ever been on. So again, I appreciate it. I thank you. And Sue or Rebecca, I turn it over to you with any questions.
We have a question. Your work is very commendable, Dr. Ruchalski. I was curious if you see many health complications, birth defects that can be attributed to Agent Orange exposure.
An amazing question, and I really do appreciate that question. Let me give you the long answer because this is a really good question. Prior to starting the mission, when we go to, we fly into Ho Chi Minh City or Saigon, there is a museum of, it's called the War Remnants Museum. And I take almost every student into that museum because it talks about the dangers of Agent Orange or dioxin, which is the chemical name, and what they used it for and what complications it had. And dioxin is one of the most dangerous and probably chemical that probably should have never been invented. And we utilized Agent Orange or dioxin to assist us in our efforts in the Vietnam War. Unfortunately, it's left an environmental hazard over there. Not just the patients who were exposed to it then, but it was in the genes, it was in their ecosystem. So yes, there are still birth defects from the consequences of what we as a country, as well as other countries, did to them. So yes, we do see birth defects from that currently. I have some other pictures of that in a different slide set. But once you kind of see one of those individuals, it's almost hard to say that it's from something else. The complication, the birth defect, and the way they are present themselves, it's pretty clear they're still having complications of the dioxin and Agent Orange.
Another student is wondering how students can get involved in this mission. They're an undergraduate public health student and will also be pursuing an MPH at Temple and would love to learn more about the project.
Okay. Again, we welcome all interested individuals. So that individual can send me directly an email, and Sue and the team you can share my email, please, with anybody on this webinar whenever needs it. With that being said, the size of this team is growing to about 60 or so people. And Mercer University kind of has the ownership of the majority of the mission. Now, Temple has built into the program. So I have taken other non-pharmacy people from Temple. So I just have to kind of get approval for how many people I can attach to the team before it becomes an unruly number of people. So it's drop me an email directly, and I'll work with you when we get the approval for the next mission, which I'm hoping is summer of 2024.
And is that whole team is at the clinic at once?
The whole team is at the clinic at once, but the clinic is separated into different areas, right?
Right.
So there'll be about 6 or 7 at the intake station, 6 or 7 in the medical room, 6 or 7 in physical therapy, 20 or 30 in the prosthetics area because it's a larger area and it takes a lot longer time and effort, and maybe 4 or 5 in the pharmacy area. So we separate them out. They rotate through. So most students get 2 or 3 days in each of those areas during the course of the mission. So they get a chance to experience all different parts of the healthcare field. And
then how do you prepare the students ahead of time, like this various disciplines?
Yep, very good. Great question. I prepare the pharmacy students, obviously, whereas the physician and biomedical engineers prepare the other healthcare practitioner team. I'll just give you my experience. Our students are recruited about 9 months prior to the experience. They have 3 responsibilities to me. The first one is they have to start thinking of fundraising immediately. So everything we do, again, has to start with a good plan. So what kind of fundraising activities they have? So we're starting our fundraising basically 9 months in advance. And it started out very modest in 2012. We only raised about $5,000 or $6,000 to do what we do. The most recent fundraising effort for our purposes was $25,000. So we had a much larger fundraising effort. That's the first thing. The second is they have to meet with me weekly to start to learn a little bit of the Vietnamese language. They have to communicate a little bit in Vietnamese. So 1 or 2 of my Vietnamese students will provide a Vietnamese class for them to help train them in the basic understanding of the language. And the third part is they continue to meet with me for additional training in physical assessment activities, which is blood pressure, pulse, and their glucometer training, their medical diagnostics, because they'll send me a nice slide set on how we would diagnose some of these orthopedic illnesses. And so they meet with me every week. So it's basically almost like a 9-month training once a week. And it still doesn't prepare them for what they see when they land on the ground. Mm-hmm. No matter how I tell them the intensity of the work, the ability to communicate with body language versus the oral verbal language, they think they understand it until they get there. And then they really get it, that you're working long hours. Those light blue scrubs within an hour are dark blue with sweat. Literally, we don't have air condition in the clinic areas in most times. So you're working in environments. So they do get some in-depth training. I do all the pharmacy training. The physician sends me materials about the orthopedic cases. He trains the nursing students, the other students who are a lot of biomedical engineers down there at Mercer.
And then some of it's just on the ground when you're there, like you're making prosthetics or.
So the team, we as the pharmacy group transport all the drugs. So I told you about 1,000 pounds of drugs in our checked-in luggage. The other, let's say, half of the team that comes from Mercer, all their check-in luggage is pre-made prosthetic supplies. So we're basically traveling with all the supplies. Over the years, this medical team has developed a relationship with a manufacturer over in Vietnam that is now able to manufacture a lot of the heavier components of their prosthetic limbs. And it's met over with us in Saigon, and then we travel. One thing I didn't show in the presentation, I showed you mostly lower extremity amputations and prosthetics. This physician team in the last mission, which was 2019 for us, he developed an upper extremity hand and arm amputation, prosthetic. And usually over other countries, they have, I don't know, the old hook, right? Like a metal hook. They have maybe some plastic non-movable hands, right? He developed a movable hand, a grippable hand that if you shrug your shoulder one way, it grips. And we fit people with bilateral arm amputations with 2 new hands and arms. Before they leave clinic, they have to drink a glass of water or they have to pull a string for a light. So he's still in the research development of all these biomedical prosthetic devices.
So what percentage of the patients do you see year to year?
It's a small percentage that we see year to year. We don't always go to the same areas, but we always go to 1 or 2 kind of similar areas. We usually hit 4 or so different regions, different provinces. 2 of them are mostly always the same. 2 of them are usually new for us. So the ones that come to the 2 consistent ones, I don't know, I would say, less than 5%, they would come back. The ones we request to come back is a different story. Like that boy, we need to see him as he grows for his prosthetic. So we sometimes request that they return to us. But a lot of times they get their treatment, they kind of move on, and they may or may not see us again.
So you were able to correct that man with the neck in one clinic?
In 1 year, yeah, in one clinic setting, which was about a 6 or 7 day clinic we had.
Mm-hmm.
It started on day 1. He came every day for continual treatment. And again, the picture in the upper right, which when he had, a lot more movement, was at the end of our 6 to 7 day clinic in Bentrea.
And are you ever connected like with local professionals, or it's literally a makeshift clinic?
Most clinics are makeshift. We set them up in either churches, government facilities, some are outside, literally like outside. But the one clinic in Bentrea has an existing clinic that shuts down for the week that we're there. So we do work with the practitioners that are there, the doctors and nurses that consistently see patients in that area. So they basically give us access to that clinic for the 6 or 7 days that we're there.
And this student says, "Hi, Dr. Ruchalski. I am Vietnamese, currently a master's student in health informatics at CPH. Seeing what you did to support Vietnamese and Vietnam healthcare, I am touched and really appreciate it. As a health informatics student, I want to hear your thoughts about this, like difficulties you have ever faced related to lacking of health information technology when you've been there."
It's a challenging question, right? There's lacking of lots of technology, lots of just access to care, right? I don't know, the technology that if you're talking about, I don't know, I'll just give you my thought on your question. Like, I don't know, continuous glucose monitors, which will be a technology that we're embracing here. They won't get to that point for decades down the road. Access to healthcare sites, like via websites and things like that, is also limited. They have it's still a socialist republic. It still is kind of led by a communist leader. So they still have kind of control over their population. I've been there where they kind of just turn off the internet so people can't use it for whatever reason. I know I'm probably not answering your question the way you want.
What about like the patient, like you're literally going with just whatever the patient tells you? There is no documentation or?
Very rarely they'll come with their records from their doctor, which will show us like their latest lab results or their latest, here's my medications. But I would say 80+% of the time, they have no records.
Right.
They just, because they don't see again, this is an opinion of mine. They are, again, a very proud, hardworking society. They go to healthcare practitioners when they need to. There's not a lot of preventative care. There's not a lot of annual checkups. There's not a lot of annual physicals and blood work, right? So those who come with it see their practitioner, their doctor, their healthcare practitioner more often, but it is very almost taking their word for their symptoms and doing the best you can.
Right. Without any labs or.
Yeah, in the rare instance, they sometimes come with maybe their own X-ray that they've gotten maybe a year ago from some other hospital. But the one clinic in Bentrea that I told you we go every year, and it's an already existing clinic, they have an X-ray machine. So if we need to, we could utilize that clinic's machine to get an X-ray. But yes, very, very often there's no good documentation, no good record keeping, even the medications they're on. Again, I told you they come in like a clear bag, no labeling. I'm, trying to figure out what they're on. A lot of times we'll kind of, I know now over the years, because there's a pharmacy, I'll go to the pharmacy that's close by in the area and I'll bring the bag over with me and or have a student do it, ask the pharmacist over there to identify some of these tablets or capsules so we get more clear knowledge. But it's a challenge. It's sometimes working blindly, but you do the best you can.
So the X-rays you have are just the ones they've brought with them? Like you don't take X-rays?
In non-Bentrea clinics, only the ones they have. The Bentrea clinic, if the physician feels he wants an X-ray, he'll order one. We can get one at that clinic. But that's the only clinic over the last, again, 10 years that has an existing X-ray machine.
Wow. And then can you just talk a little bit more about what you think students take away from this experience?
Students have told me it is the most valuable part of their 4 or 5 or 6 years of training to be a pharmacist, number one. That, yes, the traditional pharmacy activities that they're trained to do here, that's probably what they'll obviously go to do post-graduation. But for them to experience non-traditional pharmacy activities is also very, very valuable to them. I've taken, I don't know, a good number of students over the course of these years. A handful of them went on to develop their own international missions based on this experience. So, for example, going back to your Vietnamese student, I can see one of those individuals coming on this team and then saying, you know what, I want to go back and help on my own without a team or build my own team. We had a student from India who came with me who knew there was a need, connected with an Indian doctor, and then went over and developed his own little mission work over there. So if that's not the sign of growth and value, I don't know what is.
Right. And just having the understanding of what other professions, like truly understanding what other professions do.
Yeah, they see the behind the scenes of what they normally do not see.
And what healthcare does with people who don't have healthcare.
Yeah, absolutely. Absolutely.
Ironically, there was a student who says, thanks to you for sharing your experiences and is looking forward to being part of one of these mission programs in the next few years, probably in India.
Interestingly enough. And if that individual wants to contact me, I could put them in contact with my graduate who started the one in India. And that's like, the goal is, learn from this program. Of course, you come back a different person, but take what you learn. And the idea is to spread it around the world.
Right.
I only go to the southeast part of Asia. We have other mission work here from the School of Pharmacy that goes to Guatemala, Panama. There are other areas, and it's still growing as interprofessional as well as global health initiatives continue to be on the rise. We're trying to expand ours as well.
That's great. I don't know if we have any more questions. I think we are good, but thank you very much. This was very, very informative.
It is my pleasure. It's easy to talk about something you're so passionate about.
Right.
So thank you again for the invitation. I usually connect better in person, but hopefully the group on the call did feel a connection and feel my warmth and my passion to the program. So thank you again for the invitation.
And I don't know what the over-under was for the pictures, but
yeah, what was the over-under? You know what I'm talking about.
Yes.
And if Sue Scanlon is on there, she'll know exactly what I'm talking about. So I think there was like 7. So we'll see.
That's funny. Thank you very much.
Thank you, everyone.